Hello everyone who's watching this video. Welcome to Babystepmed. My name is Dr. Intisar Malik. I'm a consultant physician and currently I'm working in Riyadh in Saudi Arabia. Previously I used to work in UK and New Zealand as a consultant physician. I've also been involved in treating COVID patients. And the reason I'm making this video is to answer some questions which are frequently Googled, and people are giving different views and sometimes incorrect information. The frequently asked question is, what does coronavirus do to the body? But before I answer this question, we need to understand how does coronavirus get into the human body and from which route and how does it enter? Now, the route of entrance, what you can understand, is from face, mostly from the nose and the pharynx, which is the back of the throat. And it is spread from man to man. So that's what, if it is present on any surface, or it is present on the person, and if that person is in close proximity to us and we touch them, and it transmits to our body, our hands and things. And if we touch our face, or it is coming through the sneeze or some droplet infection, it can enter our body. So this is how it enters. And then once it gets into the body, then there is an incubation period. Incubation period means, and the first of all, incubation period for this particular disease is 14 days. And incubation period means that when the virus gets into the body and then it starts replicating itself inside the human body, and then it becomes ready to infect. We get infected and then it replicates and it is ready to affect. So when the person becomes positive with this virus and the virus is inside the human body, there could be different forms of the symptoms. Sometimes what we call it as the patient does not have any symptoms and asymptomatic. They don't have any symptoms at all, but they are still infected and they are still able to pass on the disease to others. In most of other instances, they develop high-grade fever, dry cough, generalized aches and pains in the body, feeling generalized tiredness, lethargy, and also shortness of breath. The most severe form of the disease when it affects the lungs, and the people become short of breath and their oxygen levels go down. So when the oxygen level goes down because the lungs are not functioning well, because there is a fluid leakage into the lungs, which we call in the medical terms as acute respiratory distress syndromes. It means that like this infiltrates develop into the lungs because of the leakage of the fluids, and you can understand like pneumonias, the small pneumonias affecting different parts of the lungs. And at that stage, the oxygen level goes low and patients develop respiratory failure. And we call it that the patients become hypoxic. So the progression of this disease, we can say, we can divide that there could be three different ways. The one way the patient remains asymptomatic, does not get any symptoms at all. In the second, the patient gets mild symptoms like flu-like symptoms, dry cough and things which I've already explained. And then that is a self-limiting symptoms and disease which lasts for a few days, and then the patient starts to feel better. And in the third and the most severe form, where they develop low oxygen, infiltrates in the lungs, like pneumonias, as I've explained earlier, and requiring mechanical ventilation, which is the severe form of the disease. So this is how this disease progresses. Another question which is frequently asked, whether the masks help in decreasing and getting the disease. Now, the answer to this question is mostly this disease is spread by the contact, direct contact with the objects or the person where we physically touch them, and then through our hands and things, it's to our face, and then it is transmitted. The transmission through droplets is slightly lower than the other one, but still positive, present. If somebody sneezes in front of you who is infected and has got the droplets, and you inhale those droplets, you can become infected. So to be on the safe side, if you are wearing a mask, it will give you a second layer of protection, and so it can be used. But if you're not using the mask, then you need to be very careful and need to keep a very safe distance from the people. What is the treatment of the disease? There is no specific treatment available for this particular virus. The treatment is only symptomatic. If you're having fevers, chills, body aches, you get plenty of fluids, drink plenty of fluids, take paracetamol regularly so that your temperature comes down. If people develop hypoxia, then they would need the ventilation or the oxygen. If you develop hypoxia, you not necessarily would need ventilation. Only putting an oxygen in the hospital setting would be sufficient to keep your oxygen up. But sometimes this supplemental oxygen is not enough, and the people are unable to bring their oxygen levels in the reasonable levels. At that stage, we call it the respiratory failure, and these people then would need mechanical ventilation. Now, the treatments given during the ventilation and all those hospitalizations are symptom-related, plus any complications. Sometimes these pneumonias, when developed, they become secondarily infected. When these pneumonias become secondarily infected, then antibiotics would be needed. And then in the course of their admission in the hospital, if they develop other complications, like other organ failures, if the kidneys get involved, if the heart gets involved, then the specific treatments for those problems can be given. But they are not specific to virus. There's no treatment of the virus. In the end, I would like to emphasize to all of you to take precautions which has been advocated by World Health Organization, that you need to have reasonable social distancing from the people. You do not shake hands with them. You frequently wash your hands after touching anything. Do not touch your face or nose, and be safe. And if you sneeze, you don't sneeze in the air, or you don't sneeze in your hands, you sneeze in your elbow. If you have got any more questions, please put them to this site and this place, and I'll be more than happy to answer. And I wish you all the best, and stay safe and stay healthy. Thank you very much.